A third person has tested positive for the coronavirus in the South Indian state of Kerala. The patient has now been quarantined. Our correspondent Ishan Garg joins us now from New Delhi. A very good morning to you, Ishan. What is the situation like in India's Kerala state?
Well, in Kerala, they have certainly upped the efforts to, at the very least, quarantine people who they even think are suspected that they might have the coronavirus. A number of students from the state of Kerala study at Wuhan University or other universities in Wuhan, which makes up for a large section of people from that particular state who have traveled to China in the past few weeks, are still in China or have recently traveled back from China. In Kerala, they are working with the Indian government very closely, and they have kept more than 600 people under observation in hospitals as well as in schools. And for now, this third person has tested positive. We don't know any further details apart from the fact that the three people who have tested positive for coronavirus are now stable. The Kerala government is communicating very effectively with the rest of the country. And if anything, experts are saying that in the rest of the country, if another outbreak comes out of the coronavirus, the example from Kerala might be a lesson.
Are people in India concerned, though, about the virus, given now that more than 2 cases have been confirmed in the country?
People in India are now starting to get a little worried about the virus, because for the past 1 month, people were receiving a lot of information about the coronavirus, but there were no confirmed cases then. But now that these 3 cases have been confirmed, it has slightly got people worried in India. But it's important to note that the Indian government has stepped up and it is fulfilling its responsibilities of making people aware of what the coronavirus is, what the symptoms of it are, and also telling people to diagnose themselves, to report if they see any problems with their respiratory systems, or they have a fever or things like that. So the government is interacting with the people, and this has got the people in some in a stable state. There now, there's no frenzy over this issue, but there's a slight worry. You can see in major cities like Delhi and Mumbai that people have started wearing masks, and they are trying to maintain better hygiene. But since there haven't been more than 3 cases, it's just 3. There is a slight degree of let's say irresponsibility from some of the people who are not taking up to who are not doing the things that the government are asking them to do. For example, keeping hygiene and wearing masks.
So following this outbreak, subsequent conversations have been travel bans, lockdowns and restrictions. What is the situation like in India?
Well, the biggest problem that is being faced by the people of India after the imposition of these travel bans is by business workers. There are a number of flights operating between New Delhi and Beijing and Shanghai and Wuhan, and most of these travelers are business travelers. And now just a few hours ago, we received reports that a e-visa facility, the electronic visa facility, has been suspended by the Indian government, and experts are saying that this is going to be very problematic for business travelers. It's also very important to point out that the number of Chinese travelers or foreign travelers who've been to China in the past 1 month, and if they are in India right now, they also might face some problems going back to China. As far as the Indian students are concerned, most of them have been evacuated from Wuhan. So that's one concern sorted, but there are also a number of Indian students in cities like Beijing and Shanghai, and so far we don't know if they will be evacuated or have they started moving back to India or not.
All right, today we're focusing on Kerala, but are there other areas of concern in India?
Well, the biggest area of concern in India is that one of the things that has been pointed out by the Indian government as well is that people need to take better care of their hygiene, their surroundings. And there is also a concern that if, God forbid, the coronavirus epidemic breaks out in India, India does not have the sufficient number of laboratories which can test the virus. There's a requirement for about 29 such labs in India which can test the sample for coronavirus, but so far only 5 have been identified. So there is a concern that if this outbreak gets out of hand, so far it's just 3 patients, but if it does get more than that, it might be difficult for the government to contain this. Now, the government of India says that it's working very closely with the aviation ministry, with the Ministry of Shipping, so that they can scan the airports and seaports very closely and very effectively. But as far as treatment part of coronavirus is concerned, we are not very sure of how the government will react if the outbreak gets out of hand. A number of hospitals have been told to maintain hygiene. Doctors are on high alert. State governments are on high alert. But so far, since the number of patients who have confirmed positive for the virus is still pretty low, so the government says it's prepared, but we will only find out later in the future.
Well, thank you very much for that update. We'll continue tracking the developments in terms of the coronavirus in India.